good morning. So today let's discuss about the chlorhexidine. Okay, so it also becomes an important question for various competitive examinations, including the Prometric examinations or the NEET MDS, or even for the undergraduate students as well. So let's understand what all can we study, or what are the important points which actually we don't know about the chlorhexidine. Okay, so chlorhexidine, it is used in the treatment of drug-induced gingival hyperplasia. So this is something I think a majority of you might be aware of. So it is used in the treatment of the drug-induced. Okay, it is a drug-induced gingival hyperplasia. So there covers the first point. Now second point, let's see what does it say. It is used in post extractions to prevent bacteremia. So we are all aware that after the extractions or any kind of surgical procedures, we always give the antibiotics. Now what is the purpose of giving antibiotics? Just to prevent the particular wound from the attack of various organisms, right? So the wound should not get infected. So for that purpose, we give the antibiotics. In addition to the antibiotics, we also can give chlorhexidine, which also plays an important role to prevent bacteremia. Okay, so this is the second point. Now let's see what does the third point say. It is used in the lesions, that is denture stomatitis and ulcerations. But many of us might have undergone, like while giving the dentures, many of the patients have come up with the complaint that, oh, I'm having so much of pain, I am having so much of ulcerations kind of thing in the entire mouth. Now that is denture stomatitis, right? So for that conditions also we can give chlorhexidine. Okay, so chlorhexidine, it is used in the drug-induced gingival hyperplasia. Next, it is also used post extractions to prevent bacteremia. The third point is it is also used in lesions such as denture stomatitis and various ulcerations. The next point is when the chlorhexidine breaks down or gets degraded into the parachloraniline, it releases the brown pigments, and these brown pigments are responsible for the brown staining of the tooth. That's why we always say that chlorhexidine should not be used for prolonged duration of time, right? But see, now I have easily mentioned that chlorhexidine, when it breaks down into parachloraniline, but this is not a single step. It has involved majority, like many steps it involves. Okay, so there are many steps in between the breakdown of chlorhexidine into parachloraniline, and all these steps we'll discuss in our upcoming videos. So when it breaks down into parachloraniline, it again degrades to form the brown pigments, and these brown pigments are called as the melanoidins. Okay, these brown pigments are called as the melanoidins. So how is it degraded, and how is it lead to formation of brown pigments, and what are these brown pigments actually are? All this we'll discuss in our upcoming videos.